I think we're going now. All right, let's do it. All right, hello and welcome back. My name is Nate McGill. I'm the new program director of Student Athlete Career Development, and I'll be your host for today, Maryland's Made podcast. The Maryland Made podcast provides timely, relevant, and practical information to empower student athletes to explore their potentials and pursue their passions. As mentioned in our last episode, each episode this season will be structured around advocacy, awareness, and/or athletics. Today, we'll focus on the awareness of specifically around the topic of mental health and wellness. And joining us, we have some very special guests. We have Nathan Blanken, who is the president of the Active Minds chapter on campus. We also have Dr. Yvette Rooks, who is the head physician and assistant director in the UMD Help Center. As mentioned, we'll be talking about mental health and wellness, the resources available on campus, and also sharing ways to lower anxiety and depression. So to start off, can I have each of you just introduce yourself a little bit, tell us about your role and organization and why mental health is so important to you. Dr. Rooks, would you like to start?
Sure. Well, thank you for having me. I am Yvette Rooks. I am the head team physician at University of Maryland. In total, I've been affiliated with athletics at University of Maryland for about 25 years. And I'm also the assistant director for the Health Center for Sports Medicine. And I really love being on a college campus with a lot of active young minds. And I actually love the subject and the science of mental health because we are one body. We are not a head and the rest of our body. And that especially when you are a student or just in life, that your mental health kind of is primarily important for your physical health. Because when we're mentally sound, we tend to have better habits and do better things. And so I'm all about wellness. And I think that this is a very important topic as we talk about wellness with our whole population.
Thank you.
Should I go ahead now?
Yeah, you can go ahead and jump in, Nate.
Okay, cool. I'm excited to have this conversation with y'all. I'm Nathan Blanken. I'm a student here at the University of Maryland. I'm a junior computer science major, but I'm also the president of Active Minds chapter at Maryland. We call it Active Minds at Maryland. I'm also the president of a national committee that Active Minds has called the Student Advisory Committee. And collectively, we oversee 15,000 students roughly at different Active Minds chapters across the country. Active Minds at Maryland specifically does general body meetings talking about different aspects of mental health, and nationally we support different chapters running events similar to the ones at Maryland, as well as spreading mental health resources to students all over the country.
Thank you, man. Thank you. So just while I have you here, let's go ahead and jump right into it. How can our student athletes get involved? Like, I think what you guys are doing is an amazing thing in providing resources to students, but how can student athletes kind of get involved with Active Minds on campus?
Yeah, certainly. We had our first look fair yesterday as a campus, which was super great. And one of the selling points I like to mention with Active Minds is that it can be as much or as little of a commitment as you want it to be. Okay. We try to be as open with students as possible because the goal of Active Minds is just to share resources about mental health and educate people on the different places they can get support when they need it. So we try to record all of our meetings so that way if someone has a class or they're not able to make it live, they can watch it back later and the recording, which is pretty cool. So for student athletes that might be traveling to different sporting events or having training in a class, they can watch the link back later and still get the resources without needing to be there live.
Okay, perfect. And then we talked about this before, but this is one of the reasons why we kind of wanted to reach out and include you in this conversation. Well, one, because it's Suicide Prevention Week currently going on. So I wanted you to kind of tell us a little bit about the event that you put on campus, I think a week ago, with the backpacks, and kind of tell us about the impact it had on campus. What were some of the reactions that came from that demonstration?
Yeah, so last Wednesday, the third day of class, we had an event on campus called Send Silence Packing, which was roughly a year in planning. I'm really glad that it finally happened, but we had a really big impact on the school. We handed out roughly 2,800 flyers which is a send silence packing record.
Mm.
No school has ever handed out that many flyers. And it was seen at the first look fair yesterday. I had students coming up and saying, "Oh, you were the organization that had all the backpacks out." And it was nice to see that people remembered us and thought it was a good event. It was super impactful. We had a lot of different reactions from students. A lot of tears were shed, but it was good that we could bring this light to campus and make students aware that, this is something that's really serious and needs to be talked about more. So overall, it was a good event. We had a lot of good feedback, and I think it was really impactful for the Maryland community.
Definitely. And then the backpacks represented like a life or something like that, right? I've looked on it online or through Instagram. I was still moving during our process, but it seemed to be very impactful. Definitely was, something that is major. We want to bring awareness to. So thank you for sharing that. Thank you for sharing that.
Certainly.
And my next question is for Dr. Rooks. Can you tell us more about the collaboration between the athletic department and the University Health Center? And then maybe since that collaboration, how has that been a benefit to our student athletes on campus?
Sure. And I just want to say, Nathan, I think the title Active Minds is truly important because that activity that goes on our brain is really, really important. And we want it to be positive activity. And so I thank you for everything that you're doing, not only on our local campus, but nationwide. So about 2 years ago, so I was here from 1997 until 2017. And then I left and went to Rutgers for a couple of years and then was recruited back by Damon Evans because they wanted to change the medical model of how athletic medicine was handled on the campus. Prior to that, it was kind of in the athletic department. And so with that transition, they recruited me back. And so I have the opportunity to work for the health center and report to the director of the health center, Dr. Spiro Marinopoulos. And so there's a division of sports medicine within the health center. And what that means is that we have access to, our different resources that University Health Center has, including direct access to like the lab and to like the x-ray and other departments. But under that model that I run, we now have built a pretty collaborative behavioral health component that we call sports and clinical psychology. And we have a new director who was recently hired, and she'll actually start on Monday, Dr. Christy Hall. And she'll supervise 4 clinicians who provide, sports performance and any kind of clinical psychotherapy that our 550 student athletes may need. And so most of those providers will be psychologists or licensed clinical social workers or licensed clinical mental health specialists. We also have collaboration with outside specialists. We work with 2 sports psychiatrists on the outside that we work with very closely. And also we have 2 sports psychologists who are very well known in the industry. So say someone doesn't want to use our resources here for anonymity purposes, we also have a collaborative effort to send them off campus. And so I would say that whole mental health division is strongly supported by both Dr. Marinopoulos from the Health Center and also Damon Evans from the Athletic, and also Patty Perillo from the Division of Student Affairs. She really has a pet peeve, as well as our president, Dr. Pines, about the mental health of all students on campus.
Right.
We know that now, and believe it or not, that the percentage of depression is actually higher in student athletes nationwide, as a study done by the NCAA, likely because of the pressures to perform, that some of them which have been inherited since a very young age. And now you come to the collegiate level, people are a lot of superstars at high school, and then you come to college and you're amongst superstars. And so things could happen. So we really try to do a lot of pre-screening before student athletes actually take the field. We do a behavioral health screener so we can see if there's anything that jumps out. So just think about doing 550 screening tests along with physicals every year that our team has to look at. And believe it or not, the student athletes are very honest with their screeners. And there are some call out for helps right away. There are some things that we still see suicidal ideation that we address immediately and get those people into some kind of psychotherapy and or medication. I will tell you that I've seen more requests for mental health services since I've been back at Maryland the past 3 years than I've ever seen in terms of student athletes. And that's not a norm for Maryland. That's really across the board. The Big Ten now has a mental health section, and that there are representatives from all the Big Ten schools that sit on that, and hopefully devise plans for support for the student athlete on every Big Ten campus. I know that all the coaches are really into having these services. And, just to put it out there, Coach Loxley, our football coach, has a game each year that is identified as the mental health awareness game. And this year it's the game against Michigan State on October 1st. So the health center partnership has been a very positive one. And I say that we're really growing our mental health pieces. It's also good to hear about active minds, because oftentimes the student athlete may not want to be involved in everything around the student athlete. They want to be a regular student.
Right.
And by having this access to an organization that they can join in and be a part of is very, very important. And it actually lets them feel normal, if you said that, within the student body. So I think that both things are very proactive.
Definitely. I appreciate you sharing that. It seems like a great collaboration, and it's definitely benefiting our student athletes in many ways. And I'm even thinking about students who might not have had these resources to be screened or to get these resources before coming to university. Like, I'm sure that's a huge help. Perfect. So thanks for sharing that. The next question I have is just paying attention to like the conversations over the last few years. So over the course of the last academic school year, mental health conversations have been on the rise within collegiate and professional sports. And I wanted to know, in your opinion, what do you think caused that, awareness towards to start having that conversation, in athletics?
Well, I'll just start, and then Nathan can jump in. Is that whenever there's a tragedy, it's known.
All
So
right.
last year, well, in the span of 6 months, we had about 4 suicides of student athletes who had nothing on their radar in terms of their mental health. Now, obviously, there was stuff going on,
All right.
but it wasn't risen to the level where maybe they sought help, from their parents or outside. So that is a very high number, and those are the ones that we know about. Okay, those are the ones that are that hit the news. We don't know about all the high school student athletes who are struggling. We don't know about a lot of this stuff. So whenever we have a tragedy, it hits the news, conversations are going to start. And we see that some famous athletes have also come out and have said, listen, I've struggled a lot of my life, either from PTSD, from things that have happened in their home life and their family life, or the pressures, or you know what, just life, because there are many aspects of mental health that are genetic. We don't want to address it, especially not addressed in the minority populations for many reasons. And I think one of the big ones is access to care. And that's another conversation. But I would say that it's very important that if I can go to the physician's office and talk about my high blood pressure, or to talk about my STD, or to talk about my broken arm, I should also be able to go and talk about my mood. We don't always have to label it as depression, as anxiety, as bipolar, but it's our mood, And as humans, we don't need to be happy all the time. We don't need to be sad all the time. But when one is exaggerated more, we have to investigate that and try to find out the reason why. And I think sometimes with young people, it's almost like it is a stigma. It still is a stigma. Like I'm a college athlete. I'm getting to do everything that I want to do in life. I'm getting a great education, but why do I feel this way? And sometimes you need a specialist to help tease through those things. So I think it's a good thing that we have quote unquote role models in the professional sports saying, let's talk about it. We need to have a general conversation and just, bring it up. And we need to, it's like, check on my brother. We need to check each other, and be able to have friends who will say, you know what, is something going on? Let's have a conversation about it. So.
Thank you. I mean, and I also want to add like COVID. I think that year that
Absolutely.
added to anxiety or people feeling or student athletes, students in general feeling depressed. So I would say that's another reason why we're having this conversation a lot more often than we did in the past. So Nathan, the next question is for you, and I mean, Dr. Rooks, you can jump in on this as well. I just really wanted to see if there was a comparison between the traditional student and then also student athletes. And that question is, in your experience, what would you say is the main reason student athletes on the college campus have poor mental health? So obviously, athletes have class, different stressors and that. But Nathan, I wanted to ask your question on from your side maybe what that looks like in a traditional student.
Yeah, certainly. And I can't relate to all the stressors that, and I'm sure I can't even think of all the stressors that our high school or sorry, college student athletes go through. I played a couple sports in high school, and it's nowhere close, I'm sure, to the same level of difficulty and work. But I think some things that are probably pretty common among the different sports at Maryland are students work long hours. They go between classes to sports to recovery and training. It's not just, practices from 1 to 3. It's you got to warm up and then stretch and nutrition properly, and then traveling to go to different athletic competitions. And whether it's here at Maryland and just taking time out of the day to get to the facility and get ready for the day, and then have that sporting event and have to have a post game conversation, or traveling across the country to do the same thing. Dr. Rooks, I think you talked about it really well with COVID. We were online for such a long time, and having to travel somewhere else and then take those classes potentially online or do the work online again after being online for so many years, I think can be really tough. And in combination with all the stresses of just being a student and then having to live up to the really high expectations of being a superstar student athlete, can be really tough for students. We're all humans, and most of the students are anywhere between probably the ages of 18 and 22. So it's not like they have much more experience. And I mean, looking at even professional athletes where their job is just performing, they're under enough stress now, adding classes and a social life and sports on top of it. It's a lot for student athletes to handle.
Yeah, I would say that every coach that I've interacted with, we call them student athletes because they're students first,
Mm-hmm.
and they are here to get they want them to leave with a degree. One of the things I want to compliment Maryland is they have one of the highest rates of graduation for their student athletes. And so, that's the main purpose while they're here. And as students, you're right, Nathan, they have class, they have personal relationships. They want to, they're social beings, and COVID took all that away.
Mm-hmm.
You guys are the social media age. I could care less, but you take that away. So you take that on top of being scheduled 5 to 6 a.m. morning lifts, then having runs, then having mandatory study hall, then having the classes. And sometimes they have to take classes that they don't want to take, because certain majors to fit in. And then the travel schedule. I would say that, majority of our student athletes, since many of these people start playing their sport when they're 4 or 5, have to really master time management, because that's really critical to be able to be successful. And I think that with the support staff that we have within the athletic department, the academic support staff, and just the life support staff really helps the student athlete. They bring them in early for this acclimation period to do that. But it's just also having the conversation. I think that, having our athletic trainers, and we have 20 athletic trainers, one that works with every sport and some that are doubled up. These young men and women are the first line. They know these young people like they're their kids. And so they can pick up on their behaviors, on their changes, on their mood, if they don't show up for workouts, what they're eating and things. And they really bring the information to me and to the doctor saying, I'm concerned about this person. They've lost weight,
Mm-hmm.
or they say they're not sleeping. See, oftentimes it's not so much the commentary we have, but it's the physical signs.
Yeah.
I'm not sleeping, I'm not eating, I'm having these kind of things. Those things speak to me as, hey, we need to check in on some other things. It's not like we have to run a bunch of tests or take this medicine. We need to have a conversation. And I like for my office to be a safe zone. I have an open door policy. I want people to come in and be able to talk about it. And many a day I've walked to my office and there's been a student athlete sitting there just waiting because, doctors, I just want to talk. And that's what I'm there for. I think that's what we're there for. And I would say that the student athlete day may be a little different, but as Nathan was clear, these are 17 to 22-year-olds.
Right.
And whether you play a sport or not, that's when that brain is changing. That's when we see a lot of things. That's when our responsibility is coming on. And as I have a 25-year-old daughter, and she's a Terp. She graduated from University of Maryland. She says adulthood is challenging.
Challenging. I think when you make that transition from high school to college, it's the first time you're by yourself too. You might be far from home, or you got to make more informed decisions. Things are new, things are thrown out at you. So definitely can be a trend. And during a transition, it can be a challenging time for sure.
Yes.
So let's shift gears a little bit, and this is going to talk a little bit about, Dr. Woods, what you mentioned earlier about the negative stigma. So what advice would you have to student athletes who need to seek mental health services but are scared to do so because of that negative stigma? And then kind of how, as an athletic culture, do you think we can kind of disassociate with that negative stigma, kind of overturn that in a sense?
Well, I think what we're doing right now, this podcast, and one, having Nathan here, because Nathan represents an organization on campus that ain't affiliated with athletics.
Right.
Sometimes within the athletic realm, there's a stigma that if I talk about something that's not great, then I'll be looked at differently.
Mm-hmm.
So by allowing the student athletes to know that, listen, there's this organization called Active Minds on campus that you can go to and be anonymous, that you can participate in things and maybe get up the confidence by talking to other people to seek help. So I think the foremost thing is having opportunities and having services. We also have the counseling center on campus that people can go to. We also have the health center that has mental health services. So having pockets of places that you can go to seek services and not just have one place, I think it's just really, really important. And then these different organizations. I know SAC also for the student athletes has a wellness component to it, but oftentimes you don't want to come into the doctor's office at the beginning, or sometimes you don't know how to start the conversation. Mm-hmm. So by having programs on campus where you can go to and also meet people, the green ribbon, those things are really important that you may catch your eye. And again, we still have to continue to talk about that it's okay not to be okay.
All right.
It's okay. And then what do you do with it? Alcohol is not the answer. Fighting is not the answer. But talking about, just like you would talk about any other health problem you have, we need to be able to talk about it. But here's the issue, though, and I find this in my own profession, is that sometimes the person you go to doesn't know how to help you. And they say, suck it up, get over it. You're just having a bad day. And that's not what this young person is trying to figure out life needs to hear. So we as professionals, if we don't know how to solve the problem or help them, we need to be resourceful and be able to refer them to someone who knows how to help. And I'm no expert. I'm a family doctor. I love mental health, but I'm not the expert. And so I've surrounded myself around experts and about resources that can help the young people.
Nathan, do you have any input on that, on how we can kind of overturn the stigma as a collective? Obviously, we talked about the athletic world, but just in general, I'm sure there's a negative stigma behind it.
Yeah, no, I think in the question you said mental health services, and that kind of term is something I've been thinking a lot about, because mental health services, I think, is a really strong word. There's a lot of different places where you can get mental health support. And a mental health service could be something as simple as just having a conversation with a friend. It doesn't need to be going to a doctor's office and having it be a whole big thing, which can be super intimidating for a lot of students, especially because this is maybe the first time in their life that they're on their own. For a first year student coming to university, Maryland's a really big school with a lot of people, and a lot of things are changing, especially for student athletes having to deal with classes and new sports and schedules. So, talking to a doctor might be a lot. It could be as easy as just having a conversation with a friend, FaceTiming a friend from home, talking to a teammate. It doesn't have to be, going all the way to a doctor and having it seem very professional and, thought out. A simple conversation is really helpful. I mean, the basis of Active Minds is peer support, and teammates or friends or family members, cousins, anyone in your life that you think can, just have a conversation with you can be super helpful. I can't tell you the number of times I've been on a phone call with someone and just listening, not saying any words, just letting the other person talk it out, has helped them so much. And that's all people need sometimes, just an ear to listen. And, it can potentially be as effective as seeing a doctor. And there's certainly cases where someone with a degree or a license can provide support that teammates, friends, family members can't. But for people that maybe don't want to start with a doctor, just having a simple conversation is a really good place to start.
Absolutely.
Yes, I appreciate that. I appreciate that. I'm thinking now more on the administrative side, or like support staff. Like, how can we kind of help student athletes seek these services? I think, like you've mentioned, having that conversation is a start. For myself, I'm going to try to create some type of like a one pager, a list of resources that they can take on, when they come in the office and leave. But is there any other ways that maybe coaches or administration, you would advise them to help students get into maybe these services?
So Nate, we actually have a document that we give to sports supervisors and coaches about trigger signs and then resources on campus, and we're going to add Active Minds to that. So Nathan, I'll get your information to add that up there. So that's provided. And then we also provide mental health CPR, which is a course now that is being offered by the Counseling Center, and Sue Sherburne is making that available to all of the academic supports and the academic administration. So basically, it teaches you how to recognize other things, and this one happens to be focused on suicidality. So to recognize those things. So I think that, again, with Damon and Colleen's support, we're bringing things into the athletic administration, and we've provided a handout that has the resources and key phone numbers. And again, we want to add Active Minds up there for the students, and we have that available. But I think what you said is really important, to have it in everyone's office. And so when they interact with the student, if they recognize something, they'll be able to give it to them.
Yeah, no, I think having as many resources available as easily accessible as possible is really important. But there may be a situation where a student or a student athlete comes to a coach or a physical trainer or some administrator expressing that they're looking for care. And I think it's really important that for people to feel open enough to express that they're looking for support. It can be a really hard thing for students to come out and say, hey, I need help. So I think it's important to try not to judge. I think judging is something that's not generally a good thing within society, but
Right.
just being accepting of someone coming to you asking for help, and just being thankful that they're opening up to you, because sometimes it could take a lot of courage for someone to ask for help. So if they've gotten to that point, just being able to provide any kind of support that you can. And I think having handouts in offices and providing as many different types of resources as possible can be super helpful, whether it be one-on-one support or a group session. We have anonymous peer texting lines on campus.
Okay.
There's an organization called Lean On Me CP. They are a peer-to-peer anonymous texting line. So it's students actually on campus that are trained to provide support via text. So that's something that students at Maryland have access to as well.
Well, I need to get all these things. Nate, hope you're taking notes. So we want to add that up there, so we can have peer support and be able to provide that as well. That's good.
Yeah, that's super awesome. That's super awesome. So now I want to shift the lens more to back to the student, right? And trying to figure out what they can do to kind of better themselves in this situation. So what are some different ways or activities that our student athletes or students can kind of decrease their anxiety or depression? Because like we mentioned earlier, we know that there's a negative stigma behind it. This might be for a student athlete who needs to go to services, but is hesitant. Is there anything they can do in the meantime to kind of, push this stuff under, or maybe not push it under, but kind of help deal with these different things that could potentially lead to maybe suicide or something tragic?
So, a couple things is just some basic things is sleep, making sure they're getting enough sleep. Good nutrition is also important. Staying off social media.
Mm.
And we say exercise, and exercise is important, but they're already exercising. But not over exercising, but also taking a walk. Some meditation is also important, mindfulness. But just some of the core things about sleep and nutrition are really, really important.
I absolutely agree. I think all those things are really great. I'm reading a book right now called Peak Mind that talks about mindfulness training. And one of the things that the book mentions is that you can become easily overwhelmed by multitasking. Like I find myself throughout the day, I might be sitting in class and I'm thinking about, oh, I have this assignment for another class that's due in a week. I should start on that. And then by the time my mind gets back to the class that I'm sitting in, I've missed 3 slides. And so the book talks about how it's really important that if you can, just try to focus on the task at hand.
Mm-hmm.
And if something comes up, write it down in a reminder or a note so you can look back at it later. You don't think about it now, focus on what you're doing, come back to it later, and it'll help reduce anxiety and stress.
Man, I appreciate that. I'm gonna have to, like, you see, I'm taking notes there. I'm gonna have to pick up the Peak Mind. I'm trying to get a library one day in my home, so anytime I can get a solid book recommendation, I'm gonna jot it down. Perfect. So I have a few rapid questions to wrap up. All right. So, what keeps you up at night regarding mental health? Is there anything that comes to mind when I ask you that question? Anything to keep you up at night?
I think one thing for me that keeps me up at night, like I think we're really grateful to have, such a big university with so much support and, listening to Dr. Rooks today talk about all the different resources that student athletes have, and just knowing about all the resources that are on campus for the 30,000 plus undergrads Maryland has, I think is really amazing. But at the end of the day, there's never enough resources. We have all these different texting lines and counseling center and peer support, but there's never enough. And I think that, we could have tens of millions of resources, but it'll still never be enough. So as much as we can provide, I think is amazing. But we're just going to keep working and getting more resources out there.
I would agree. It's the ones we miss.
Mm-hmm.
I go home and I think about my day and about the students I taking care of my clinic, and I said, did I ask all the right questions? So yeah, it's the ones we miss.
Gosh, I think for me it'll be very similar to say the ones we miss, the ones who kind of don't know they're struggling with different things because of maybe they're just accustomed to, living in that type of situation. So I'm definitely there with you. My next question, my last question for you all is going to be, what are you personally doing in your life to take care of your personal mental health? What are some things that you guys are doing?
I have found that with the start of school, my schedule gets to be very busy. I am a big fan of Google Calendar.
Okay.
If there's not an event on my calendar, then it doesn't exist. So any free time on my calendar is my personal me time. And oh man, do I love my me time.
Right.
Whether it's reading a book or just laying in bed, just decompressing from the day. Enjoying my me time has been great. And I've also gotten a hammock.
Okay.
Campus has a bunch of really great hammock spots, whether it's on the mall or up on North Campus. There's a little hammock haven in the Cambridge community with some hooks and just set up the hammock, lay out there, maybe, do some work on my computer on a nice day. It's beautiful.
That's awesome.
For me, it changes. I
Okay.
think I'm a baby boomer, so I have a 25-year-old, I have a 16-month-old granddaughter, and I have a 93-year-old mom. So I'm multitasking, and I have 550 student athletes, so I'm multitasking. To me, it's sleep. If I can get my 7 to 8 hours of sleep, that's a pet peeve for me. Um, and it's very important because the sleep dictates my next day. And if I don't get good sleep, then my mental health is thrown off. I'm a little bit more irritable, or things like that. So it's sleep. My exercise, during the first couple months, gets disrupted because of the schedules and stuff. But I'm planning on getting that back together. But for me, it's sleep. It's getting adequate sleep.
Love it. I think I don't get enough sleep. That's something that I need to get better at. But one thing that I'll do is I've been trying to implement like morning meditation, at least for maybe 20 minutes, maybe some mindfulness activities. And that has helped. I mean, I just started recently, like maybe early this month, was trying to do it every day. And I can tell a difference when I'm just, more relaxed going into whatever's coming up next. Another thing I do is run. I like to run. I try to run as much as I can. I mean, I haven't done it recently, but overall, that's what I do. It's a time for me to get away. I can get in my mind, think, and say some positive affirmations about that. But I definitely appreciate you all coming out here today. Thank you for your time. As you know, health and wellness is an extremely important topic for today and within the Maryland Made team. We definitely take it seriously. So thank you all for coming and spending some time with us. Um, we'll definitely make sure that we put contact information about Active Minds. We'll post some resources within this podcast as well, just so everybody who's paying attention can go ahead and check those out. But thank you all. We'll see you next time. You guys have a good weekend. All right.
Thank you.
All right. Perfect. So I'll go ahead and end the recording. We'll edit that. Let's see.